As we mentioned, it is 20 degrees and mostly sunny in Brisbane. A beautiful day out here in Brisbane. It's looking just amazing. So in what has been announced so far, so let's take a look at what has been announced. So in line with Deputy Premier's announcement yesterday, the lockdown has been extended for 11 South East Queensland local government areas until 4 p.m. on Sunday, 8th of August. These restrictions are different and more strict than previous lockdown restrictions. This means no visitors are allowed to visit your home unless providing paid or voluntary care for a vulnerable person. You must stay within 10 kilometers of your home or accommodation as much as possible. And if you are sick, stay home and get tested. You can go further for the following reasons and the following reasons only. Essential work. Now, essential work is any work that cannot be done from your home. Healthcare, or to buy groceries or medication that you cannot get near your home, or to take a child to an essential worker in a school, or to have COVID-19 test or COVID-19 vaccination, to provide care for a vulnerable person. So these are the ones that have reasons that you can go out, and these are the reasons only. And the government is requesting us to pass this information to our community as these important messages to assist in stopping the spread of COVID-19. Now, if you need further information, please visit www.health.qld.gov.au, or you could visit the other site, which is www.covid19.qld.gov.au. Stay safe and keep up to date. Stay tuned to our channel as we will bring to you regular updates as and when they happen. And don't forget that today we have a very special studio guest, Chris Taman, and he is coming in after the general news. Well, as we have heard about the Queensland lockdown, let's take a look at what it is actually looking like. Well, apart from the lockdown and this pandemic, it is a beautiful day out here in Brisbane as I look out the window of the studios, looking at the quiet streets in a very quiet Howard Street Wharf, and I look at the Cathedral Palace and past the valley. It looks all very quiet and peaceful, and it's a wonderful sunny day, partly cloudy with 20 degrees today. So they were up to date on Brisbane Indian Times. Right now, that lockdown as it has been announced in Queensland.
As the Delta strain snowballs,
this outbreak, unfortunately, is escalating.
It's the youngest Queenslanders in its path. At least 6 schools are now caught up in the rapidly escalating cluster. Of today's 13 locally transmitted cases, 10 are under 9 years old. All are linked to Ironside State School in Brisbane's west. 7 are students, 5 are household contacts, and 1 is linked to karate lessons held on school grounds.
I really am very, very concerned about these 6 schools.
The missing link as to how the virus spread from 2 returned overseas travellers into the school is still not known. To give authorities more time, the lockdown across the southeast will be extended until at least 4 p.m. on Sunday.
We need to lock down really, really hard, the hardest we've ever locked down.
That will make it an 8-day lockdown. And we desperately hope that that will be sufficient for our contact tracers.
The millions of Queenslanders under stay-at-home orders are being told to do just that, with the Chief Health Officer issuing a stern rebuke to employers.
I cannot understand why anyone would be in an office today. If you are in an office today, why aren't you at home?
There's too many cars on the road in Brisbane at the moment, too many people out and about.
Calls to increase testing numbers were answered, with more than 21,000 COVID tests carried out in 24 hours. But many were left waiting for hours or were turned away.
We're extending all of our clinics to the times that they can be managed. We're getting extra workforce in.
With 66 active cases in the state, positive patients will continue to be treated at Brisbane's 4 COVID hospitals, but they're already under strain.
We're looking at how we can urgently ramp that up.
Dr Young says at this stage she's not pushing for high school students to get vaccinated with Pfizer and wants those most at risk of spreading the virus to keep coming forward to get the jab. That includes aged care, health, hotel quarantine and airport workers. Rachel Rieger, ABC News.
And of course, that is a very, very worrying condition there, especially when it's now spreading to the younger ones. Before the young ones is to go without the mask and say, we are excluded and that, nothing will happen to us. So that is very, very bad. And as that in that message, Dr. Young could not be clearer. And the message was, if you are in an office today, why are you not at home? So, is your work classified as essential? Well, I'm sure as he mentioned office and not studio. So, for us, we need to get the message out there to the community. And of course, we are operating the studios in a very, very low staff manner, meaning one person running the whole lot. So we have to source the news and run it that way as well without the production staff. So we manage as much as we can. But the important thing is that we are in that position where we need to get the message out to the community. So we have to do the right thing as well. Well, right now, Norman Swan discussed the strategy in these vaccines, and they'll also look at the Queensland case here as well, courtesy of ABC.
Let's get more on the COVID outbreaks in southeast Queensland and Sydney. For his take, Dr. Norman Swan, presenter of RN's Health Report and the ABC's Coronacast, joins us from Sydney. Norman, good morning to you.
Hi, Lisa.
Hey, can we just go straight to southeast Queensland, because we're seeing these figures and the fact that so many children are contracting it and that it's linked to the various schools. What's your take on it?
Well, it's a reflection of the fact that the Delta does seem to be drifting into younger age groups. Before the school holidays in Britain, I think the week before the school holidays, 640,000 children in England, I think it was, rather than the whole of Britain, were on furlough, either because they had COVID-19 or they were a primary contact. So it is a spreading group. And it really does need to be taken seriously. It's partly because the older people have been immunised and it's drifting down, but it may have a predilection for younger people. And the issue here is, should we change our vaccine rollout, the priority there? Last night on 7:30 I had Emma McBride from James Cook University on talking about that, where and they've done the modelling, and her view is that you do the vulnerable groups, which is the over 60s, get them done, but actually then focus particularly on the teenagers up to about the age of 30 or 40, because those are the people who are catching it and transmitting it. So controlling hospitalisation and then controlling the majority of the biggest groups who get the infection would be the most useful strategy, as we're short of vaccines. And that group is exactly the group that's twiddling their thumbs waiting for the Pfizer doses.
And you've made the point in the past, Norman, that if kids aren't vaccinated, they risk getting seriously ill on a long-term basis. Other doctors, epidemiologists have made the same point. But we go back to, again, at this stage, at least, the lack of supply, particularly when we're speaking about Pfizer.
Yes. But you could, the possibilities there is to redirect the supply that you have towards that. So partly they've done, just a clarification of the severe disease, it's still the case that children are far less likely to get, just to reassure parents, are far less likely to get severe disease and die. But young people and children do get long COVID, and I think that's what you're really referring to, and that's what you don't want to happen. And yes, you could redirect the supply, which is to some extent what they've done in New South Wales, but for a different reason. They're immunising Year 12 students, and they're getting a bit of pushback from other parts of the state there. But if you follow Emma McBride's thinking, that's you get kids back.
We helped out our neighbours who we know were in lockdown. If they need a food parcel, if they need groceries, give your neighbour a call. Don't go knock on their door. Give them a call if you've got their number and say, do you need any groceries or items? Leave a care package at their front door. That's how you can help. But please, don't go visit your neighbours right now, because as we've heard today, one of the new positive cases is a neighbour. Now, of the 16 new cases today, at least 9 of those are young people. 9 are confirmed students, and we have another 5 household members, which potentially there may be young people in that household group as well. So a minimum of 9 out of 16 are children. So let's make sure we're keeping our children safe and our most vulnerable in the community by staying at home and following the directions. Now, yesterday I understand the Commonwealth Health Minister announced that he could offer 150,000 extra AstraZeneca doses to Queensland immediately. That is fantastic. We will take them and more. I've already phoned the Pharmacy Guild yesterday afternoon on hearing this news, asked them if they had 150,000 vaccines available of AstraZeneca, can they use it? Can they get this in the arms of Queenslanders across southeast Queensland in a matter of days? And they've said yes, they will take it. So I asked the Commonwealth, do whatever accreditation or approvals you need to give today, get the 150,000 vaccines here tomorrow, and we will ensure that more Queenslanders are getting vaccinated by the end of the week. That also goes for GPs. I've heard from GPs that in the last 48 hours, they have been getting an enormous amount of calls from people saying, I want to come forward and get my AstraZeneca. That is great news, but now some of them are worried they're going to run out of vaccine. So if there is more supply available, we will work to get that for them. This is really important because we've had a 4% increase in vaccination doses over the last 24 hours, which is incredible. But of our 60-year-old to 69 age group, less than 20% have had their second dose. So what we'd like to do, and only just over 42% of 70 plus have had their second dose. We would like everyone going to get their first dose of AstraZeneca to go to a GP, and we want that to be every GP that is on the National Immunisation Program. Every GP or pharmacist who is eligible to deliver a flu shot today should be eligible to deliver the AstraZeneca. So we've been asking for this for months. The quicker we expand, more GPs and the pharmacists, the more we can get our people vaccinated. So what we'd like to do is people go to their GP for their first vaccine, consult with their GP, and once they're ready for their second dose, we want our pharmacies to be there to roll out that second dose for as many Queenslanders who are eligible and can get it. So thank you to the Commonwealth for that call and offer of 150,000 AstraZeneca. We'll take it. Our pharmacists will take it. Let's get more people vaccinated. Thank you.
Unfortunately, yesterday saw the highest level of enforcement we've had to undertake since the pandemic began. We issued 70 penalty infringement notices, 34 of which related to the protest activity we saw here in Brisbane. And we also arrested 21 persons, 15 of which related to that same protest activity. We responded to 146 calls for service, so they continue to rise, and we handed out 168 masks. I'm sorry to say that the types of offences we're seeing in this is exactly the same ones that we've seen all the way through. People failing to carry masks and refusing to put them on when they're given the opportunity to do. People being out and about in the lockdown when they don't have an exempt purpose to do so, so no valid reason to do that. People being given directions and the opportunity to comply with police and refusing to do so. It's really quite unacceptable that all of our community vastly take this very seriously. We in the police take this very seriously, but there is a portion of our community that think that they can continue to do whatever they think they want. We're simply not going to tolerate that. We're going to increase our presence in the community. Our community can expect to start seeing things like an RBT type interception on our roads, where we'll check to see whether people have the right reasons to be out and about and whether they're going about their business. The community has nothing to worry about if they fit within those exemptions and those valid purposes for going out and about. Of course people need to go out and get essential supplies. Of course people need to go out for essential purposes. They have nothing to fear. They have nothing to fear if they're doing the right thing or trying to do the right thing. Our police officers will help them. But those people out there, the message is very clear to you. If you know you are doing the wrong thing and you do not intend to change your behaviour, there are serious consequences. It is a $1,378 fine for contravening a direction from an emergency officer, which includes our police. It's a $206 fine for a mask. And if you continue not to comply with our directions, you face arrest and being put before the court. Thank you.
anti-masking thing, the people who are refusing to wear masks. We've heard police are complaining that there's circulating on social media directions about you can say, I have an exemption either at this group. But are you finding that happening?
Look, there are genuine medical reasons, and I can leave to the show to talk about why people don't have to wear a mask. What we expect when we engage with them is that they can work with us to prove or show that that is a genuine purpose. We will always take a communication, compassionate approach to that. So we'll work through them. But if people are deliberately trying to mislead, there's really quite serious consequences to this. I was really disappointed to see some reporting last night where a gentleman was saying that masks don't work. The science and common sense tells you that's absolute rubbish. People need to stop listening to that sort of stuff. It's just not correct.
Can I just respond, please? Could I just talk one moment? I do want to raise this. If someone cannot wear a mask because of a medical reason, and if they have not had 2 doses of vaccine, they need to stay home. They shouldn't be out and about. These masks are to protect people. So if you cannot wear a mask because of a medical reason, and there are medical reasons for it, and you haven't been vaccinated, you are at really high risk. So stay home, and the Care Army has been activated again, and they will help if you can't organise food or essential goods. Don't go out of your home if you can't wear a mask. I hope I'm being really clear. That is to protect yourself. Please don't find excuses to not wear a mask. I think masks have stopped the last 14 incursions of this virus into our state from spreading. It is just this 15th one that has led to spread. Masks are absolutely critical. Thank you. I don't know the specifics of any of the cases other than the information that's already been given. On Sunday, I will want to have seen that any new cases that have been coming up have been in quarantine for their full infectious period. Not many at the moment. Some of them have been out infectious in the community for up to 6 days. It's too early in the outbreak to expect that all of these people will have been in quarantine. No. It'll be where those people have been. Someone who's been in quarantine for their full infectious period doesn't concern me. It's people who've been out and about, so there are more exposure sites that worry me. Yeah, oh yes, definitely. Although I've got some more genome sequencing today that is starting to show that this virus is branching off, which suggests to me that those 5 initial cases in that family were fairly closely related to one of those 2 cases. There's still missing cases between them, absolutely, but possibly not a large number. But even one, we know, even one case can lead to another outbreak. We know that. So that's why the 11 LGAs, it's critical that anyone with any symptoms at all in those 11 LGAs comes forward and gets tested, and that people stay at home, because there's about 20% of people who won't develop any symptoms, but they can still spread it. That's why lockdowns work, because they keep the people at home who don't have symptoms, who could lead off to another transmission event, because they mightn't have symptoms, but the person they give it to could then get symptoms, and the next person.
On the Gold Coast, the mayor's calling for lockdown because they haven't had medical infections. What do you say to those?
I think he's subsequently clarified that opinion. Can I say the mayors here in Queensland have been absolutely brilliant. I speak to them on a very regular basis. They are such a congenial group, and they really work well together, and they are the basis of our response in any disaster in Queensland. They are absolutely critical, and they've been working with me so closely in terms of testing venues, in terms of getting people vaccinated, and supporting each other. So really, I think that's one of the reasons that we've had such a great response in Queensland.
The 9 new cases that are students, how concerned should parents be given we're seeing with younger friends with younger people.
Yeah, parents do need to be concerned, so that's why they need to come forward and make sure their kids are getting tested, which they're doing fantastically.
There's a lot of confusion out in the community around what an essential worker is.
Yeah, we did put out some clarification last night, but if you've got a question whether you're an essential worker, then you're probably not. So really and truly, my advice is if you can stay home till Sunday 4 p.m, when I hope we can lift this, then please just do that. Just stay home.
Are you aware of a case of two people, a couple in Roma, that come from Victoria with permits?
Yep.
There may be questions over they fill the permits out incorrectly. That's not being disputed. And the Deputy Commissioner may be able to add something on this as well. They were then ordered to the edge of town by police, told to drive to Roma. They tried to drive to Brisbane, get themselves to hotel quarantine without test results. Subsequently, they broke down halfway.
Oh dear.
Were told by police that they weren't to stop. It's a 480-kilometre journey. Are you comfortable with this process? And
I just want to thank every single person. I don't have it on me today, I'll get it for tomorrow. How many Queenslanders have gone into quarantine from the start of this pandemic? Let me finish, please. Let me finish. I really and truly, they have been the absolute heroes. I haven't done it myself. I know our Premier is doing it today. To spend 14 days in isolation is awful to ask people to do, whether that be at home or in hotels. But that is so critical. That is what has saved us time and time and time again. If we hadn't have had that process from early last year, we would have been exactly where so much of the rest of the world is. So I don't know the specifics there, and I'm sure police, it's all right. I am very comfortable with our process for asking people. Could I finish, please?
That they've driven themselves.
Yeah, could I?
Without a test result.
Yeah. We don't need test results. Test results are too late. Please, no one out there rely on test results. It's our job to get test results. Till anyone gets a test result, they need to isolate themselves. They can do that in a car on a drive. Of course they can, if that's what they've been directed to do. We'll look at that specifically. But look, I just say this is not ideal that people are having to quarantine, but it's one of the best mitigating factors that we have. It is so critical, and I thank every single person in Queensland who has gone through quarantine, and I know some people have gone through it multiple times, but that is what has kept Queenslanders safe. Now, as for the specifics, if you can give the media team the specifics, and of course we'll go and look into it. Of course we will. Thank you very much for raising it. Several have. So today there was another teacher, and we've previously had several teachers. So it is really important, and we've brought that in now, that teachers, when they go to school, no matter what age group they're teaching, unless it's deaf children, must wear a mask. We know masks protect. For deaf children, they need to wear a shield so the child can see their mouth. Not out of this cluster. We still have one gentleman in ICU. He's not ventilated, but that's from a previous cluster, not from this outbreak.
But on the implications for the health workers, have you made any progress in?
Yes, unfortunately we have well over 400 of our health workers now in quarantine. So last night I had to make a decision because all of our cardiac surgeons for the Children's Hospital were in quarantine, so we worked through how we could allow one of them to go and operate on an urgent case, and we will do that every single time. No Queenslander will be denied any care because the health workers they need are in quarantine. We'll work through that. But we do have a large proportion of our critical health workers now in quarantine, so unfortunately we have had to delay some surgery and some outpatient work to manage that, so but we'll be working that through.
Is it an option to rotate people in the regions?
No, because the regions have already been impacted because any of their health workers that have been in Brisbane haven't been able to return to the regions. So the regions are already struggling. So no, we can't rotate. Most of them have, yes, that's a very astute point, but unfortunately at this stage we know that although you've been vaccinated you can still pass it on, and this is too critical. We cannot have health workers go into a hospital who can potentially pass on the virus, because then we risk that entire hospital, as we saw a few months ago with the PA being totally closed down. So we've got to work it through, but that's why last night we worked through that worker was quarantined so they could go in and operate. Most of them are. Most of them have been infectious in the community. Of those today, some of them up to 6 days.
On that reiterated message that you keep saying, you said yesterday, quite adamantly that if you're in an office and you don't need to be, you shouldn't be.
Yeah.
How does that extend to broader exemptions for retail? We're seeing things that were concerned in Sydney when they had Louis Vuitton shops open. Here we've got JB Hi-Fi, Cotton On. Where's the line on that, and is that being enforced? Are they being essential?
Live updates from
They're not essential
Queensland
to me.
Parliament.
I would hope that they've heard that message and they make a decision.
Do you think the warnings around AstraZeneca for younger people has contributed to Queensland having the highest vaccination hesitancy in the country?
I don't believe we do have the highest vaccine hesitancy. What I want to see is that anyone who is 60 years of age or older immediately goes and gets vaccinated. I am concerned that there is still a significant proportion of that group, and that group is most at risk of getting the worst outcomes, that isn't yet vaccinated. So I will be going this week to get my second dose of AstraZeneca, because it's now more than 8 weeks since I had my first, and we're now in an outbreak, and the ATAGI advice is that in an outbreak situation, instead of waiting 12 weeks, you only need to wait 8 weeks. So that's really, really important. And anyone younger than 60 should go and talk to their own GP about what their risks are and what they should do.
Should they now be sort of pulled up the line a little bit?
Well, that's why schools, and the Minister is here and can speak to it, are asking teachers to stay at home where that's possible, because unfortunately, much as I would absolutely love to vaccinate every teacher immediately, we just don't have enough doses yet. So any teacher who's 60 years of age or over, and there are some, should be going and getting AstraZeneca. Younger teachers need to go and make that decision with their GP. Yeah, some kids can attend school, but only those children of essential workers. I need our hospitals to continue. I need police to continue doing their job. So there are some people that I need to be able to still go to school, and of course any vulnerable children. But education has a very, very good system in place. They're cohorting kids into smaller groups to minimise the risk, and they're managing it very, very carefully.
Are you comfortable with the numbers of children turning up? And also, do you have a message for employers who are still requiring their employers to do the same amount of work, even though they're at home with their children, and that pressure to send their kids so they can get their work done?
I am sure that employers are very understanding and will work with their staff. It is hard, I am sure. My kids have grown up now, but I'm sure it is very difficult to work at home when you're also looking after young children. But that's what I'm asking everyone to do wherever possible, and hopefully we can lift that on Sunday. But if we all do that really hard work now, it can bring this to an end. If we don't do that hard work now, this is likely to linger on.
Around the outbreak situations, also suggested that he would reconsider the risk benefit ratio. Have we reached that point?
The ATAGI advice says when you reach a large outbreak, which I think we're on the verge of, I hope it doesn't become any larger, but I suspect it will, that then that is the time to go and have that discussion with your GP. Kid, yes. 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 No, I absolutely agree with it. The Commonwealth has worked very closely with us, and as you heard from the Health Minister, has given us 150,000 extra doses of AstraZeneca. I want those extra doses going into arms this week. That's critical. Yes, that is the trigger when the Commonwealth gives us additional resources and also gives financial assistance. So yes, I think that is a very good trigger point.
Sorry, should young people be talking to their
Yes. This is the time that people who are under age 60 should be talking to their GP about what is best for them as an individual. GPs know their patients and know what advice to give them.
Deputy Commissioner, can I ask a question, Deputy Commissioner? Just again on this case of this Roma couple, I don't know whether you've been briefed or not, but they were told, given a direction by police, driven to the edge of Roma by an officer, then told to drive the 480 kilometres to Chermside. They were then told by the officer the only way they could stop is if they had a credit card to swipe at a petrol station. They then told the officer their car wasn't right. They broke down halfway. They then rang police again in Roma when they'd broken down, which the police replied to them, "It's not our problem." They were then told that if they didn't arrive on time, they would be fined again. A 480 kilometre drive without a stop.
Question and answer session with
so
the
I'm
media
aware
briefing
of your story, so I've asked for a
House.
complete briefing on the circumstances around that. I haven't got that yet, so I can't comment on the facts of that particular instance. I'm aware that there's a process that we have been using all through this pandemic because of the large numbers of people we have, and this is done in collaboration with Queensland Health in terms of ensuring that we can get people into quarantine the most effective way. Now, one of the things we have in our system is that we place great trust in our community and their honesty and their ability to work with us. So yes, there are instances where people are given directions and asked to go there, and there's conditions put around that, and that's been happening consistently through. So that's the process. The individual circumstances of this case, as I said, I need to get a full briefing on it, as the Chief Health Officer said, and work out what's happening.
We've seen on so many, there's been so many examples of people doing the wrong thing, for the most part people doing the right thing. Again, would you be comfortable with that process of allowing people to drive themselves, through these small towns all the way to Brisbane to report the quarantine?
So I'll dispute your assessment there of the large numbers, because I can tell you that we've intercepted over 1.5 million vehicles, and we're talking about a handful of instances where things have not gone well, and that's really validated by how the infections have unfolded in this state. It has been a very effective system. So we're talking about very small numbers here. Now, if there's been a particular instance, where we've got it wrong, I want to know about that, and we'll look into it in detail.
What have the other breaches been? You talked about protesters. What other breaches have you seen?
Look, the protests, we see real consistency. People are out against the Chief Health Officer's directions for the purposes they should be out, so essential purposes. Look, in thousands of instances, people simply don't understand, or they think they're doing the right thing. We work with them, we give them advice, they then comply, we move on. The people, and I'll say it again, the people that end up having enforcement action taken against them are the ones that are given an opportunity to comply and willfully and intentionally disobey the directions.
What's being done about businesses though, Steve, like eating games and hot-on?
Yeah, we're doing business compliance checks as we always have. I don't have today's figure, but as of yesterday it was, for one day, I think we'd done over 70 businesses checks. All had been compliant. Thank you. And look, I think, go back to what the Minister and the Chief Health Officer said, ask yourself not whether you can, ask yourself whether you should, and if you don't really need to and it's not absolutely an essential purpose, stay home.
But are you asking them to police that themselves rather than from enforcement?
Throughout this whole pandemic, and indeed in this week.
The message is quite clear that if you are not an essential worker, you need to be home. You just don't need to be out and about. They can't get any clearer than that. And of course, when we look at the compliance, that the police are now actually going into businesses to see who and which ones are open, and if they are open, why are they open, whether they're compliant or not.
As agreed with the Commonwealth is frontline workers and the 40 to 60-year-olds. So it was agreed, and as per ATAGI's recommendation, those people were getting Pfizer. So we have always been the primary administrator of Pfizer vaccine. to those priority groups, and the general population, so those 60 plus who are to get AstraZeneca, have been getting delivered through GPs and the Commonwealth vaccination centres. That is the agreed plan between the Commonwealth and states and territories. We were delivering Pfizer, and the GPs and the Commonwealth vaccination centres were doing the AstraZeneca once the recommendations changed around ages. Now, as advice changes, then we will change our approach as well, but we still believe that the pharmacies and our GPs are in the best position to roll out the AstraZeneca to the general population. One, because people should go to their GPs and get advice, and also pharmacies administer our flu vaccines every single year. People have confidence and trust in going to them for immunisation. And we know that if we can redirect second doses from GPs to pharmacies, we can free up a whole lot of booking spaces with GPs for those first doses. So I think we've got...
This first doses, I actually went to my GP yesterday because I had the first jab of AstraZeneca and waiting for my second, which is due on the 26th of August. And my GP explains to me, showed me a sliding scale. He said the effectivity of getting it on 12 weeks is about 89%, and it reduces, if we have it earlier than 12 weeks. And if you have it earlier than 12 weeks, he said later on you might have to go for a booster one as well. So he said, in your case, in my case, with my health situation, he said, it's best to wait for that 12 weeks and get that second one done. Well, right now we have to go to the interview for today. I'm sorry that it's been a little bit late because of this very, very important news brief here from Queensland Government. Gentlemen, once again today we bring to you some very, very important news within the community. The use of translators, certified translators from professional with NATI translator accreditations. Many people who use services and skills of professionals with NATI translator accreditation are in challenging phase of their life or in the middle of a paper war. When an authority requires a NATI translation, or more precisely a translation with a linguist with NATI credentials. Visa applications, citizenship applications, new passport, divorce and legal proceedings are situations that people deal with every day. So the migration translators are leading providers of language services to migrant communities, helping more than 60,000 individuals every year in their journey towards settlement in Australia. They work with many government agencies. Most of their work is done by translators and interpreters who are NATI translator accredited, which is a prerequisite for many official procedures in Australia. Today, we are very fortunate to have the founder and director of Migration Translators, Chris, with us joining in the studio. So welcome to the show, Chris.
Thank you so much for having me. A pleasure.
Thank you so much. So in the light of this unprecedented pressure that has been put on migrants, especially under these very trying times of COVID, how are migrants, or how can they get their documents translated for free by the Australian government?
Yes, so this is actually a very established service that has been in place for many years. It's called the Free Translating Service, and it's an initiative by the Department of Home Affairs. And in summary, this service allows holders of certain visas to get key personal documents translated for free. What people have to do is they have to go to a certain website. It's translating.homeaffairs.gov.au. And on that website, they can check if they're eligible to receive free translations of their personal documents.
So that it's a very vital and very useful information, especially for our migrant community there as well. Chris, moving on, right at this moment, we know there's so many border closures, etc. So what documents migrants should have available when applying for a travel exemption?
Yes, so travel exemptions are, of course, the hot potato at the moment. Many people are trying to leave the country to visit family, visit relatives overseas, and for this they need a travel exemption. So when applying for this exemption, the most important thing to remember is that you must prove that you have a compelling reason to travel. The authorities will very carefully assess your paperwork based on the evidence that you submit. So you have to make sure that your paperwork's in order, and if the evidence is not in English, you will need to get it translated. Now the question is, what sort of documents could that be? First of all, we're talking about any sort of evidence that you have to go overseas. Maybe it could be medical letters related to the illness of a family member overseas. It could be a letter from your employer showing that you're traveling for a business reason. Or it could be evidence that you have already made arrangements overseas in terms of a long-term stay, like a lease agreement. So whatever your case is, whatever you want to use as a reason for traveling, make sure you have the evidence to support it.
And that is quite important, that you do have the evidence to support whatever your reasons may be. So, when we're looking at, say, the translation service, what to look for when using the services of a translator, and how can people avoid problems?
Yes, so the most important criteria in Australia is to use the services of a NATI credentialed translator. So this is a translator who has a certain certification issued by the National Accreditation Authority for Translators and Interpreters. And this is what you require whenever you submit a translated document to a government agency. It applies to basically all onshore visa applications, and it also applies to the travel exemptions at the moment. That's the basic requirement. But then again, not all translators are equal. You have to make sure you find someone who has experience with the type of documents that you get translated, to make sure that the terminology is right. And small errors can have grave consequences. For example, an incorrect date or an incorrectly translated job description. Just make sure you seek someone with experience. Our specialty is anything visa and migration related, so all our translators have a lot of experience with these personal document matters.
So that is once again very, very important. So in being in that field and being in that space, so what does it feel like to work as a translator or an interpreter, and how can this be a very good job opportunity for migrants?
Yeah, so anyone speaking 2 languages, English and 1 other language, could in theory become a translator. So it can be a good opportunity for migrants. Just important to understand that full-time employment in the translation industry is not that common. So when you start working as a translator, most likely you will run your own business, you'll get your own ABN, and you'll run your own shop and then work with other clients, work with translation agencies, with government departments, and then you can build your business bit by bit. But it's flexible work, and it's great if you already have another job too.
Well, that is quite a good opportunity there. So, ladies and gentlemen, we have been speaking with Chris Damon, who is a migrant himself and has been working in this translation and migration industry for over 13 years. So, Chris, before I let you go, just one question or a comment off the cuff is many times we see translated pamphlets and events that have been put out by government or some other agencies, and when you read it, it is direct translation, but many times they do not make sense. So, how do you overcome that? Because, a conversational thing is quite different to just being grammatically correct, or same as if someone goes into Google Translation and finds it will translate the words, but sometimes it does not just get that message across.
Absolutely. That's a very important question that you're mentioning. And a translator should never translate word by word as translation apps might do it. They have to convey the meaning. They have to make sure the message is put across. So what we do is we work according to the international standards. It's called ISO 17100. And it essentially means that all the translations go through a 2-step process. A translator does the translation, and then a second person does a revision, leaves comments, tracks changes. And then the 2 linguists together come up with the final version. Both of them have to be native speakers of the target language as well. And by adhering to this quality system, we can make sure that nothing is lost in translation.
Now that is very, very important, because through experience I have seen some material previously put out, and I think so that's why Migration Translations is doing a wonderful job. So now, if people want to get in touch, how do they contact you?
Sure. The easiest way to get in touch with us is on our website, migrationtranslators.com.au. And if you need a document translated, you can just upload it on the website, and then you'll receive a quotation from us within a few minutes. We work 7 days until midnight, so whenever you make contact, we're always here. Or if you prefer the phone, we've got a number as well, 1-800-900-063. I'll just say it again, 1-800-900-063.
And Chris, once again, thank you so much for sharing that very vital information with us, and keep up that wonderful work.
Thank you very much for your time.
Ladies and gentlemen, that the segment as well, and we will have quite a few interviews lined up. Very, very important topics for the community, and we will bring to you as we go along. And with the situation in Queensland, with the lockdown, if the need be, we will go live again to make sure that we bring out, that news that is important to the community to you. Well, one of the things that I want to touch on before we finish off today is whether or not you are eligible for some grant during this time.
Well, more Australians are now eligible for the Commonwealth's COVID support payments, with areas of southeast Queensland now declared federal hotspots, along with parts of Greater Sydney. In addition to the now $750 payment for workers who've lost more than 20 hours a week, top-up payments for those on income support also kick in from today. To explain how it works, we're joined from Canberra by Services Australia General Manager Hank Jongen. Hank, good morning. Welcome to News Breakfast.
Good morning. Thank you.
So today is a big day because you've got a whole lot more people who are going to be applying. Are your staff ready for it?
Look, we absolutely are. And just to give you some sort of context, since the lockdowns began, we've already processed 1.2 million claims. And generally, we've been doing that within 24 hours. We've mobilised staff right across the organisation. Some 14,000 staff have been moved away from normal behind-the-scenes activity to ensure that we meet the requirements that we're facing at the present time.
Yeah, quite a few people sort of saying it doesn't make sense though that they're having to go in to have ID checks, and we've seen these queues that have formed outside Centrelink offices.
Well, look, there's two things to be said. If we do, in the rare event that we ask people to produce their ID, because if you claim through MyGov, we do ask you for information about your employer, including their ABN number, the hours you've lost, but also details about your ID. In the rare occasions that we ask people to produce their ID, they're actually given 18 weeks to come in because we are operating in a COVID-safe way. And in relation to these payments, no one actually needs to come in because we've developed an online contactless way for people to claim. The reason...
So there you are, the online system there, so there's no reason to be queuing up. When it's asked for your IDs, why would people want to hide their IDs? If you're making a claim, government has got a duty to know who you are and whether you are the rightful person making that claim or not. Well, very quickly, I know we are running out of time. Very quickly, Anthony Albanese, he has proposed a $300 cash bonus to everyone, and of course we'll look at what ILP says about.
The government should adopt this. We put forward wage subsidies last year, and the government said it was a dangerous idea at the time until the queues formed around the corner of Centrelink offices, and then they came on board after business, unions and Labor were advocating for it. This is just a practical suggestion. It's constructive. I'm disappointed the government has reacted the way that they have, given that the Chief Medical Officer, Dr Kelly, said earlier this year we need to provide every incentive possible for people to be vaccinated, and we know that Australia at this stage is running pretty close to last in the developed world when it comes to the rollout of the vaccine.
So there you go, $300 incentive to get vaccinated, but Simon Brigham rejects that claim.
We've got 19% fully dosed up. You don't like the idea of a $300 cash incentive?
No, because we've looked at it and the evidence says that it's unnecessary and unlikely to work. And indeed, if you do look at the different age cohorts of Australia, in the over 70s, who were the first group of Australians to be eligible to get a vaccine, we're now exceeding 79% of over 70s have had their first dose. So if you look then right through all Australians over the age of 16, around 41% of all Australians over the age of 16 have already turned out for their first dose. And we're seeing daily records set in terms of the number of Australians turning out and getting vaccinated.
So there you go. According to him, it's now since giving that $300 incentive. Well, the last thing is that federal parliament resumes, but, you know, how many politicians will be there?
Parliament returns tomorrow. Well, some of them returning tomorrow.
Can you hear me?
Yes, I can. The speaker will just sort of say, member can't be heard at the moment, can you just check you're muting?
It seems like you've done a very good job. It seems to have been working well.
When it comes to the agenda this week, yes, I think it's going to be COVID, bloody COVID.
So there you go. The agenda there would be COVID, and more COVID. So as was reported, and of course the new technologies all being put in. So ladies and gentlemen, going to the events, I will not be showing the event section because a lot of events have been postponed or cancelled. And Gopia Queensland yesterday had an emergency meeting and have decided to postpone Gopia's India Day Fair, the iconic event that was going to take place on 15th of August at the South Bank Piazza. We have been closely following the direction of Queensland Health and Queensland Government, and of course the community safety is of prime importance, and hence this move to wait and see what the results are and how long the lockdown is going to last and what sort of impact it might have on the community, and based upon that, very soon we will be announcing when the India Day Fair will be held. So, you know, just be informed that India Day Fair on the 15th of August at this moment has been postponed to a later date to be announced. And this is in line with the directions given by Queensland Health and Queensland Government, and also working very closely with the venue in the safety of community health. And of course, similar events that have been put on hold is Sarga Music's the musical night, and that has been put on hold as well. And Lalita Kalyala's the dance concert has been put on hold as well. So there are many events which were taking place this weekend. They've been placed on hold, and of course looking at the 15th and the 14th, even many functions in those weeks have been put on hold as well. So it will be interesting to see how we turn out, but be rest assured that as soon as we hear about something, we will let you know, and if there are any important updates, we will come live once again. But until then, you know, it's goodbye from me. Look, whatever you do, please remain safe, and as Dr. Janet said, that if it is not absolutely vital, do not leave home. Do not allow anyone else to come to your house. You can work in isolation, that is fine, but you know, you just cannot be out there in the public. And if you do have to go out, make sure that mask is on. It's very, very clear. You know, looking at the numbers there, you know, 16, which is quite high. So it is, and also the alarming fact is that it's getting into the younger generation, into the children. So that is sort of very disturbing news there as well. But anyway, we will keep monitoring the situation and we'll keep you up to date. And right now, the weather mostly sunny, a little bit of cloud later in the day, and the temperature has now crept up to 22 degrees. With that, I need to say goodbye.